Hi there, and welcome back to our YouTube channel, and you may even see this on Instagram or different other avenues that we publish a lot of our stuff at. So I know that many of you would probably wonder what happens behind the scenes. So you may have come in for a consultation for a rhinoplasty. You may have even gotten some imaging done. All of these various things happens at the consultation. You get a bunch of instructions, so on and so forth. And then what happens? So what happens before I actually walk into the operating room? So prior to each and every rhinoplasty, in almost every single case, I have a homework session where I sit down with the photographs. And actually, for example, this patient has a photograph of herself with a little quarter that's put on the picture so that I can scale it. And what I'm actually going to do is draw out what I want the result to look like. So once I can actually do this and draw out the result, then I actually write down the steps that I need to do in order to get that result. And this serves as a blueprint of what I can expect to do in the operating room. So very similarly, when you build a house, you've got to have a set of blueprints so you know where what goes what in what order. That's kind of what I tried to achieve here by doing this exercise. And this happens whether I do a rhinoplasty or whether I do a facial rejuvenation. There's a blueprint of what is going to happen. So I'm going to take a few minutes break. I'm going to do my little drawing and then come back and kind of show you kind of what happens. So here we are back. It's been a few moments and I've done my preoperative planning on what I hope to achieve in this rhinoplasty. So as you can see in the interim time period, I've drawn out where I want the nose. The other line represents where the nose actually is. Now, when I took this patient's photographs in the clinic, I took a photograph with a quarter taped to her cheek. So when I printed the photographs, I measured the diameter of the quarter on the printout, and then I know the real diameter of a quarter, and I created a scale. So I've actually have a scale drawing of how many millimeters I need to take down in each of these places. And here is my blueprint or instructions of what I hope to achieve and how the steps of how I'm going to get there. So this hopefully gives the viewer a little bit of background information on part of rhinoplasty really is artistry and experience. So as we're doing this, it's not just the computer model that we say, oh yeah, we can do it, but it's actually translating that into a surgical game plan and then getting that result. So this is a process of continual self-introspection and self-assessment. So this is what happens in the long hours outside of seeing clinic patients and being in the operating room. So if you decide to come here for a rhinoplasty, then you too will end up as a blueprint.